Okay, good morning, everyone. My name is Whitney Harmel, and I'm the Executive Vice President of the Maryland Chamber of Commerce. I'm also the host and moderator for the final installment of our four-part webinar series in partnership with UnitedHealthcare titled Healthy Employees, Healthy Business. We have partnered with UnitedHealthcare to bring together healthcare experts as well as health and wellness professionals to explore wellness from the employer's perspective. In today's competitive job market, it is more important than ever to stay current on what employees are seeking in a new job opportunity, and benefits certainly play a huge role in their decision. Our conversation this morning will be centered around 2023 benefit trends to help attract and retain talent. With open enrollment right around the corner, companies should be using this time to evaluate the benefits being offered to ensure they are competitive in the market. You will hear from 5 experts today to discuss what is working for their organization and what benefits they see as trending. A big thank you to our friends at UnitedHealthcare for sponsoring this webinar series and for giving us the platform to make this important information accessible to Maryland employers. With that being said, let's get started. It is my absolute pleasure to introduce our panel for today's discussion. Lori Armstrong has 27 years of experience with UnitedHealthcare, serving in account management leadership roles for both public and private sector employer groups. In the role of Vice President of Account Management, Lori has overall responsibility for the retention and growth of existing large group customers in the self-funded and fully insured space. Great to see you as always, Lori. Thank you so much for being here, as well as the other webinars that we've had. Kathy Coughlin is the Vice President of Human Resources at the Presidential Bank, and she has more than 16 years of experience. Kathy leads hiring and recruiting, benefits management, payroll and employee retentions, as well as providing strategic support to the Board of Directors, Compensation Committee, and Governance Committee. During her career, she has been instrumental in providing leadership and process oversight for 5 merger and acquisition transactions. Kathy, thank you so much for joining us today. We're happy to see you. Nick Soares is the Director of Specialty Sales and Account Management for the UnitedHealthcare of the Mid-Atlantic. In his role at UnitedHealthcare, Nick is responsible for the sales, distribution, account management, and service of all of the specialty prospect clients in the Mid-Atlantic region, which includes just under 1 million members. Nick has now been with UnitedHealthcare for 10 years. Happy to see you again, Nick, and thank you very much for being here. Patty Blinier is the Senior Human Resources Generalist at Homespire Mortgage, which just this year in 2022 was named by the Washington Post as one of the top workplaces. She is a SHRM Senior Certified Professional and earned a Certified Compensation Professional Certificate at Cornell University. We are grateful to have you with us today, Patty. Thanks again. And finally, we have Carolyn Bone. She's a Human Resources Generalist at Mid-Atlantic Waste Systems with nearly 20 years of experience in the HR field. Her past work has seen her in a variety of industries, including retail, healthcare and manufacturing, as well as government contracting for the Army, Air Force, and State Department. Good morning, Caroline. We appreciate you being here. All right, so before we begin this conversation, I would like to encourage all of our audience members to ask questions. This is your time. We want to make sure that you leave here feeling fulfilled and getting answers to those that are most important to you. So we want this to be interactive. Please use the Q&A window to add your questions, and I will do my best during this conversation to interject them, and certainly at the end of the conversation as well. So let's get everything kicked off and started. Kathy, I'm turning to you first. I have a 2-part question, and the first part of that is, how do employers get employees engaged in their benefit and health plans?
The answer to that is the answer to so many questions in human resources. It's all about communication. Your communication has to be clear, it has to be attractive, and it has to be delivered frequently. There's a really good reason for the old saying, out of sight, out of mind. People don't think about their health benefits until they need them. They don't really think about their health in general until there's an issue, there's a problem, there's a concern. So communicating the value of a healthy lifestyle, communicating the value of the benefits that your company offers is just an incredible support for your employees. And it will help to keep them focused if you keep it in front of them. If you have a great wellness program, make sure that you're communicating that out to your employees regularly, or again, it'll slip off their radar. They won't pay attention. They won't take care of themselves like they need to.
So what means do you use for communication? Is it email? Is it social media? Is it a group of people in your office?
Well, you can use a combination of things. We certainly rely on email very heavily, but want to be careful not to overwhelm people. If they see your name pop up in the inbox every day, they're going to start ignoring you. So you have to come up with a regular schedule that works for you and works for your workforce and get that message out to them regularly. Postings in common areas, with attractive or colorful pictures, things that will grab their attention in areas where they come and go frequently are great options. Talk about it when you have an opportunity. Word of mouth is still the best advertising.
Excellent. So all the employers that are listening in today that really want to support their employees to help them maximize those benefits, what advice can you give them?
Make sure that you're tracking how your benefits are being used. I think that that's really beneficial in determining what you need to focus on. There are some things that people will automatically use regularly, but there may be some benefits that are a little more obscure. Maybe they're newer to your platform that employees aren't as familiar with. Utilize your resources through your benefits advisors, through your plan carrier to see what benefits are being utilized well and frequently, and what benefits are maybe falling off of your employees' radar, so that you can focus on those. Provide them with instructional material on how to use them. Sometimes it's not as straightforward as we think it is. We're used to seeing this material, we're used to utilizing the benefits, and it's somewhat second nature for us. But for folks that aren't actively involved, a little bit of instructional material given out, maybe a focus on this benefit one week, a focus on the next benefit the next week, with some instructions on how to utilize it will help.
I think that's great advice. And I saw Laurie came off mute, but is there anyone else, Laurie included, that has any best practices from their company that they'd like to share at this time? Not yet. Okay. All right, Laurie, I'm coming over to you. I know you're responsible for large group at UnitedHealthcare, and you've been there for a long time. Your expertise is vast. But our question for you is actually because a lot of the businesses that tune in are small and medium-sized companies. And so we'd love to know how those companies can stay competitive with the benefits that they offer.
Yeah, no, I think a lot of the themes are the same, whether you're small, mid-size, or large. And really, I think I'm going to echo a lot of the things that Kathy said. Part of staying competitive with benefits is ensuring that employees are aware and understand all of the fabulous benefits that are offered to them. Often employees, express confusion over how their health plan works. UnitedHealthcare did actually a recent survey of new members and found that only 40% of members said that they had an excellent understanding of their benefits, which can lead to confusion, unnecessary or added out-of-pocket cost, and honestly, a general dissatisfaction. So having a, thorough employee onboarding process for new hires is really a great way to start things off and to ensure that your employees fully understand their benefits and really the complete well-being package. At UnitedHealthcare, we often use our field account managers to record short brain sharks for our customers that highlight features of the plans. And that's a great way to deliver a consistent message throughout the year, when the companies that we work with are onboarding their new hires. Interesting, in a recent Business Group on Health survey, 86% of employers said that employee benefits are very important to their ability to retain and attract employees. And since the beginning of COVID, benefit priorities have really shifted. The top two priorities now for employers are improving mental health access and expanding virtual health services. So, employers we see, whether it's small, medium size, or large, are really focused on accelerating telehealth or virtual health access and adding on to their mental health benefits. Often, these benefits, as Kathy mentioned, are utilized as part of the company's medical benefit offering. So really ensuring employees are aware and understand how to utilize benefits is critical to the success of your benefits program. The other area, I think voluntary benefits also remain an important part of an employer's overall package. In 2021, we saw customer interest increase in the areas of legal, cancer, critical illness, and pet insurance. So, not only can these additional voluntary benefits be personalized, they help support the overall well-being of employees. And Kathy touched on this too. Employee wellness really has shifted over recent years, away from a focus of just primarily physical health to a more holistic wellness approach. So offering employees a comprehensive program that includes social connectiveness, job satisfaction, financial security, emotional health, and physical health is a great way to stay competitive and to attract and retain employees. And when you look across those 5 dimensions of a well-being program, some of the things I would suggest is consider making, well-being activities or challenges that are group-based. That allows employees to work collectively together and give them a sense of job satisfaction. Offering seminars on debt counseling or financial planning help address, the financial security needs of your employees. And even providing stress management or mindfulness classes to address emotional health, I think, are a great way to get employees engaged and really promote the value of the benefit package that's being offered. So, choosing the right combination of health benefits, voluntary benefits, and well-being programs that really align with the culture of your organization, because that is going to vary, industry to industry and company to company. But doing those things, I think, is really going to help you meet the needs of your employees and stay competitive in the benefit space.
Lori, you had a lot of really, really great points jam-packed in there. I am curious from a small business perspective and taking what Kathy said about communication. Do you have any tips or tricks for those small businesses who may not have a full-time HR person on staff? Maybe they're using a third-party resource to help with that. Anything that you can advise them to do when it comes to communicating those health benefits? Because I think we're really seeing that you need to meet people where they are. And we can't make an assumption that every young person doesn't need health care or isn't looking for those benefits, or someone of a later generation uses them all the time. It really is about individual health. But for those small businesses, how are they communicating with their employees?
I would suggest starting off by reaching out to the account manager, whether it's with UnitedHealthcare or another carrier. We have a lot of template resources that we can share so that they're not reinventing the wheel. I mean, we've got calendars and PDFs and communication, taking advantage or asking if they could put together a brain chart. So I think really the starting place so that a small organization doesn't feel overwhelmed is reaching out to their carrier's account manager and having that conversation about what sort of canned and template resources could be used to help them in their communication efforts.
I think that's great. And knowing that they have someone that's there to help them through to educate the employees, I think is really important. So thanks, Lori. Appreciate all that insight. Caroline, I'm coming to you with this next question. It's a one-parter, actually it's a two-parter. So we're going to start with the first one. Your experience in HR covers a multitude of industries we heard earlier. And I know you spent some time, I believe, in Doha, Qatar, if I'm correct in that. What common initiatives or incentives have you seen that have been successful?
So I think at this point, employees generally come into an employer looking for, what you might think of as basic benefits. So generally, medical, vision, and health, medical, vision, and dental are the three big ones. Something that surprised me is employee discount wellness programs. What I mean by that is the opportunity for an employee to get a portion of their premium taken off due to their health status, whether that is by doing a biometric screening, and if you're within the healthy guidelines for things like BMI, blood pressure, cholesterol, things like that, you save $50 a month on your premium. If you're a non-smoker, you save $50 a month on your premium. If you're don't qualify through these things, maybe there's opportunities of programs that you can do. So I've previously we had a walking challenge. If you walked an average of 10,000 steps a day over a quarter, you could potentially get a small discount off of your premium on the next quarter. So anything that helps those employees save money, whether it's coming off the initial premium or whether it's an opportunity to maybe join a gym or something like Weight Watchers. I've done Weight Watchers meetings in office before that were very successful, where the ultimate goal obviously is to get your employees as healthy as possible. So giving them that opportunity to save money while doing so is definitely a perk.
Caroline, I want to go back to the question I talked to Lori about in terms of small and medium-sized businesses. Do you see any differences for our smaller employers versus our large enterprise employers?
So I've worked for both. Currently, my employer has about 130 employees in 10 locations over 4 states. So I do email communications, but a lot of my employees don't have email. So we do posters. I send out notices when I'm physically in the locations. I bring out benefits to people. Hey, did you know that we have a 401k? Are you enrolled in it? We have a company match. Anything to just encourage them to do that. On the, the difference with the larger employer is it was more of a tiered down. So maybe your particular person in your location was kind of your benefits person, whereas with smaller companies, like Lori said, maybe you don't even have an HR person. Maybe it is that account manager at UnitedHealthcare or another company that's doing that, but definitely utilize that person. As you said, there's a lot of information out there that you can utilize, and it saves you a lot of time. Rather than trying to reinvent the wheel for yourself.
Great. I mean, I'm really seeing a common thread between Kathy and Lori and Caroline. It's the communication, regardless of the size of your business, and maybe companies considering, you do something during onboarding, which is really critical because the employees new, but it's also overwhelming. So maybe there's a 3-month or 6-month mark where employers or HR departments can go back to their employees and remind them in special sessions what's available. I think that would actually be really helpful. So Caroline, thank you so much. We're going to move over to Nick. Nick, good to see you. Again, another 2-part question. What recommendations do you have for retaining and attracting top talent, given your role at UnitedHealthcare?
Yeah, great question. So, and it's an easy answer when I think about it. It's give them what they want, right? And not what we think they want when we're going out and trying to get that talent to our company. When you think about it, it's a sales role. It's a frontline sales role when you're trying to bring in that talent into your company. You're trying to sell your company's values, the culture, to bring folks in. And there's an old adage in sales that says, people hate to be sold, but they love to buy, and people buy for their own reasons. So you need to find those reasons. And a perfect example of that, for example, a recent employee benefits trend study from 2022, for the first time in the top 10 of need to have benefits, people are asked, what type of a benefit would you need to have in order to consider working for an employer? Critical illness cracked the top 10. 46% of all respondents said that that was a benefit that they would need to have to consider going to an employer. And when you think about that, and I know from the groups that I look at every day, and from my marketing team telling me where all the white space is where we can go and sell, that 1 in 2 companies across the country don't have critical illness. So again, that's a gap in, not sometimes understanding completely what folks are looking for, as opposed to what we think they're looking for. And if we can close that gap, I think that that's going to make it, we'll be a lot more successful in being able to attract and retain talent at our organization and other organizations.
So you answered my question about what trends are you seeing, when you're out there talking to businesses. And I think we heard Lori say something earlier about, mental health. And I think now that the world is talking about that and having open and honest dialogue about their own mental health struggles, that we're seeing people are asking for those services more. I want to open this up just for a moment before we move on to Kathy, Patty, and Caroline. And from your businesses and from your perspectives in your seats, are any of you seeing trends that Nick maybe didn't mention in terms of what potential employers or employees are coming and asking for in terms of healthcare? Nothing? Kathy, maybe?
I think one that I've seen is the employee versus employee contribution. So how much the employer is contributing towards them. I'm seeing more companies, as we're all struggling to find talent over the last couple of years, I'm seeing more and more companies offer higher percentages, or maybe even cover at the bare minimum that entire employee only premium. I know some people that have told me that they're getting their employee plus family coverage covered 100% by their employer. So I don't know if that's something that's here to stay, but it's definitely something I've seen and heard about over the last couple of years.
Interesting. Thank you, Caroline. Patty, Kathy, anything to add before we move on? Go ahead, Patty.
Yeah, we have done the same thing. We've seen the same success with offering a full coverage for the employee only level. We've not ventured into fully covering family yet, but that is something we might begin to look at. One of the other things we're seeing a lot of requests for with potential candidates is HSA or FSA funding on behalf of the employer. And then obviously the education that goes along with knowing how and when to use that to the benefit. So an ongoing education on how to use their benefits.
Excellent. Before we move on, Nick, I'm hoping you can jump back in real quick and answer a question that we have from the audience. What do you mean by critical illness benefit? Can you describe that in greater detail for us?
Yeah, so critical illness benefit is basically, think of it like a catastrophic illness type benefit. So, and a lot of different carriers offer it in lots of different shapes, forms, and variations. But the underlying foundation of what a critical illness benefit is, if someone has diagnosed with cancer, if they have a heart attack, if they suffer a stroke, if they have organ failure, a number of different major catastrophic illnesses that they would have that would be unanticipated, that benefit would pay out a lump sum benefit to the employee. There's also different riders that you can attach for wellness, right? If you go to the doctor and get your annual physical, it pays you X amount of money. You can elect dependent insurance within that program as well, where there's a rider for dependents, a spouse or children if they have one of those catastrophic events. And again, it pays a lump sum benefit. It's becoming increasingly popular, especially as employers and organizations move towards high deductibles and HSA plans. When you think about the main reason why an employee may not want to enroll in one of those plans is the fear of having to put that outlay out of pocket up front if they have a catastrophic illness for that entire deductible. And by offering either a voluntary plan or some way of an employer modified plan paid for a limited benefit with a buy-up, you can construct it to alleviate those fears. That way, if one of those catastrophic illnesses arise, there is a way for the employee to get money to help put towards those medical expenses and deductibles.
So as I said in the opening, we're headed into open enrollment, which I know is a very stressful time for many healthcare organizations as well as employers to make sure that they're offering the best benefits to their organization. And Nick, just to confirm for those listening, if they are interested in something like a critical illness benefit, I assume every company covers something different, but that there might be a list that is provided to the employer to provide to their employees.
That is correct. So in terms of the actual illnesses, that would be all generated during the proposal process and summaries. And again, every carrier is a little bit different in some of the things that they cover, but that's always disclosed right up front and typically as part of a proposal process when you're going out to the market to secure bids from different insurance companies. They'll all be very clear about what the things are that they cover and what they don't cover.
Outstanding. Thank you. I had never heard of it either. So great question from the group. All right, Patty. Let's bring you into the conversation a little bit more. Again, another two-part question here, and congratulations to Homespire Mortgage for being voted as one of the top places to work by Washington Post. So in your opinion, what makes a business a good place to work? That's a bold question right there, but come on in.
There is, yeah. So, obviously besides the general, a very healthy compensation and benefit plan, to kind of echo what my fellow panelists have been saying with expanding beyond that a little bit across all of the areas of benefits. We think to have a great place to work, we want to feed the needs of our employees, know our employees, work with them, have a really outstanding communication platform with them, so that we have and maintain a positive company culture. It's something we are really, really proud of at Homespire for maintaining that once we went entirely remote during COVID, and we actually haven't come back to the office. So it was a little bit challenging at first to maintain that really positive company vibe. So we're really proud that we were able to maintain that and still earn the top workplace award for 2022.
That's outstanding. So what have you heard from your employees about the aspects of the company and its benefits that they feel are most important to them, especially now that you guys are remote? What benefits are they telling you that have been beneficial to them?
They have been really receptive to the wide variety of benefits we offer. Everybody has a medical plan, a dental plan, and a vision plan, right? That's the basic. But we, like Lori was mentioning, we offer some financial wellness abilities, the voluntary benefits. And the employees have really enjoyed our communication platform, the theme of the day. It was challenging, but I think we have kind of found our groove with how we communicate with our employees. We're all remote. So obviously email is big, but we have enacted a sort of once a month or quarter, depending on how busy we are, meet with HR and learn about your benefits Q&A session. And we do that monthly or quarterly, and we take suggestions from employees, and we do education sessions. We kind of bribe employees to come in with prizes, but it has worked out really, really well. And I think just having a really educated employee base, listening to them and serving their needs is what helps us keep a positive culture and earn that top workplace.
So I know for a fact our director of operations is listening right now, and I'm getting an idea that maybe during our weekly staff meetings, she could bring one fact to the staff meeting every week where she just lets us know of an additional benefit that we could all take advantage of. It's just those little things that help keep people in the know. I want to open up to the rest of the group, Lori, Nick, Kathy, and Caroline. Anything that you're hearing from your staff, your employees, about the benefits that you're offering that they have really come to appreciate. And I know, sometimes people are afraid to come and say, I'm so glad we have the best dental plan or a mental health plan. But, have you all heard anything from your internal folks about what they're appreciative of? Lori?
Yeah, I mean, at UnitedHealthcare, I mean, we actually have a branded logoed sort of well-being program. And I know we already mentioned sort of, discounts from a premium perspective, but, offering discounts to fitness apparel, to Peloton subscriptions, to Apple Fitness. So, I think at UnitedHealthcare, our benefits team does a great job pushing out information on a regular basis, not to overwhelm us, but, just sharing all of the wonderful things that we have access to as being UnitedHealthcare employees.
Great, thank you, Lori. Kathy?
One of the things that I have received some feedback from our employees on, especially since the start of COVID and challenges surrounding making your regular doctor's appointments, the telehealth feature, teledoc, employees have gotten used to utilizing that kind of service as a result, I think, in large part of COVID and social distancing. And it's become a very popular component of our benefits offerings, which couldn't please me more. It's convenient for the employees. It saves them time and money, and it saves the company money because it's less expensive than the traditional in-office doctor appointment. The other trend I've seen lately, more so than what I have in the past, is employees utilizing our mental health services, employees inquiring about employee assistance programs and what's offered through those programs, what's covered through our health plan for mental health services. And I think that we've all come through a stressful couple of years, and offering those services is a great benefit to the employees.
Absolutely. We've seen some agility in the last couple of years from the healthcare industry needing to make things more readily available in terms of telehealth. And so it's been nice to see that people are able to take advantage of that. Nick, I'm going to come over to you.
Yep, and I'd say what we're seeing internally with our employees and even with the companies that we're working with and what they're starting to value is they want people to be healthy, right? We know that a healthy employee is 53% more productive than an unhealthy employee. The employees want things to be easy. There's been so much burnout lately with COVID. I think there's stats that show, 70 to 80% of people that respond say that they're burnt out in some way, shape, or form, and they want their benefits to be tangible. They want different carrots and levers and value adds embedded within those benefits that will help people engage with the benefits. They appreciate the benefits more. They're going to appreciate their employer more. And the more they're engaging with their benefits and their health plans and all the different products and provisions, the healthier an employee you're going to have, which at the end of the day is going to create happiness for both them and you.
Thank you, Nick. So we had a question come up, and I think this is a good one. I saw Patty shaking her head about the telehealth, and Kathy, of course, Caroline. How have you guys gotten employees to engage in a teledoc situation? What have you done to encourage that? And have you seen an uptick in the number of people utilizing it? But what steps did you personally take to get that done?
Sure. We actually, because of the jump in the need for mental health services, we bounced up our EAP service to include mental health free visits that rolls right into the health plan when employees need it. But we've also, to increase the telehealth usage, we decreased the deductible. So it's one flat small fee, which again, I think like Kathy said, is much less than an in-service visit. So it encourages employees to utilize the telehealth first. That's a win-win for everybody on cost and convenience.
But I think there's also a cultural aspect to it within your own company, right? Allowing employees to, don't necessarily have to say that it's a doctor's appointment on their calendar, but marking off a 30-minute personal time, I think, and creating that safety environment where people can take, maybe it is for mental health, maybe it is for counseling or what have you, but they have that time on their calendar because we have gone to being a little bit more flexible, I think, in a lot of work environments as well. Has anyone seen that in their organization?
I think we've gone to, so because we're manufacturing, the majority of my employees do have to be in the office full time, but our corporate office has gone to a hybrid model. At the beginning, I'd say about a year ago, September of 2021, we officially went to hybrid with 4 days in the office and 1 day remotely, and then ended up going to 2 days in the office, 3 days remotely at the beginning of March of 2022. I think it's been a big benefit for our staff because our offices are so spread out. We don't interact with the branch employees that much, even when we're in the office, because they're not physically in the same location as us. So there's not a big difference for me or my accounting team or my purchasing team or whatever, as far as availability. Most of what we do is through Zoom, through phone calls, through emails, things like that. But it gives employees some flexibility as far as childcare and the commute into work, things like that. I know we expanded our EAP significantly at the beginning of COVID to include the mental health services. Again, just making sure employees are aware of it and utilizing it. We don't track our use at all. It is 100% confidential. So I don't know how many employees have actually utilized it. I have people that have come to me and shared, I'm so glad we have this, not just for mental health, but for financial reasons, or a couple of employees that have, aging parents that need assistance beyond, maybe what that child can provide. Yes, you're trying to manage your own, you're working, you're managing your own children, and you're trying to manage a parent that maybe can no longer do things for themselves. But just making sure that's available. And again, going back to the communication thread that we've been seeing throughout the entire call, that just making sure that people are aware of that. Aware of the telehealth. It's nice to be able to, jump on a call from my desk in the middle of the day and have a 5-minute conversation with my doctor, instead of having to pack everything up, drive 45 minutes to the doctor's office, sit there for an hour, see the doctor for 5 minutes, drive 45 minutes back, end up losing 2 or 3 hours out of my day. And now it's maybe 10 or 15 minutes.
Yeah, and you bring up a great point about it in your company, at least, that you're not reporting out on who's using certain services. So that creates another safety environment as well. Lori, from UnitedHealthcare's point of view, and I want to stay on this teledoc because I think it is really important. What kind of resources are you offering to the businesses in your plan?
Yeah, I mean, one of the things that I think our account management staff is making sure that our employers know that within specifically our behavioral health network, that there are multiple virtual options. We probably have 5 or 6 companies that we've added to our network, where it may be eating disorder therapy, it may be therapy related to adolescence, which is a huge gap in the community. So one of the things that we do is make sure that our customers understand, beyond just sort of the big telemedicine vendors like a Teladoc, there's lots of other embedded providers within the network that specialize in certain areas within either behavioral health or substance abuse that our members have access to, and it's all virtual. At the beginning of the pandemic, everything was virtual. It was your primary care visit, it was your cardiologist visit, it was your mental health visit. We've really seen a general return to in-office on the physician, on the medical side. We have not seen a decrease in the engagement and use of virtual as it relates to behavioral health care. That has remained consistently high since, beginning mid-2020.
Great, thank you, Lori. I'm going to pause there because I think is my encouragement. We're having a really good conversation. You guys have asked 2 outstanding questions of our panelists today. They have varying backgrounds, different levels of expertise. Let's drop some questions in and see if we can get some answers for everybody today. So I'm just going to turn my head and read this question, and I'd like to open it up to any of the panelists today. Why are companies so reluctant to embrace 100% remote work if there is data available that supports it based upon performance measures? So, think about it from a healthcare perspective, of course. Are you seeing anything in terms of people in your network, or even Lori and Nick, those businesses that you guys are providing to? Are you seeing and hearing anything regarding that reluctance for 100% remote work?
Well, to me, I think it all depends on the nature of the business, right? There are some businesses that just don't allow it. When you think about some blue collar groups that we work with, construction companies, paving companies, those types of industries where it's just you can't have everyone working from home. They need to be in an office or they need to be on site. I really think it depends on the group, right? I think it depends on the culture of the organization. I think it depends on the culture of the team that you work on within that organization. And honestly, I also think it depends on the work ethic and the culture of the employees, right? And past historical performance. Sometimes you may not be able to treat a certain team the same way as another team, even within that organization. Just think about the example I used at a blue collar group. The accounting team may be able to do their complete job from home. The team that's out on the street actually paving the roads may not be able to do it. So there may be some perceived issues, perhaps, between the different groups within the same company if you allow one group to stay home and one group not. But it's definitely a tough question. But I think it really is a case-by-case basis, depending on the group, the industry, and the makeup and the demographics of the group in your company.
Thank you, Nick. Lori, did you have anything to add?
Yeah, I think you have to balance out the benefits that we talked about in terms of a hybrid or a 100% work at home environment with what you lose when you're together in the office, the teamwork, the collaboration. And to Nick's point, I think every organization's culture is probably a bit different, but you've got to work really hard to ensure that employees within their individual units and teams stay connected when you're in a 100% remote environment.
And employees have the option, depending upon their circumstances, to choose. And if they're really looking for that opportunity, hopefully they can find something that suits their skill set with what they're looking for. All right, so I don't have anything in the queue. Let's open it up. I've got some questions here for the entire group that I welcome anyone at any time to come off mute and to answer. But let's talk about this first one. What outcomes do you recommend tracking to determine if a benefit plan is successful? Really important question here. So again, what do you recommend tracking to ensure that your benefit plan is actually successful for your employees? And how often are you tracking it?
I can jump in. I'm going to answer this, I think, from the perspective of the wellness or the well-being program. I think the number one thing in terms of tracking if it's successful is participation. So whether, Patty, it's your monthly, webinar or call, are people attending? So I think participation is probably number one. The second is, do you have a mechanism to solicit feedback from the employees? So is there some sort of formal survey? And that can be broadly across benefits related to a specific activity, but I think soliciting employee feedback is probably the second most important, maybe it's even the most important area in terms of determining whether the plan is successful or it's being perceived as having value by your employees.
Anybody else want to jump in? Are you tracking any of this data or surveying your internal staff?
Clearly, it's important to do pulse surveys and monitor utilization. But we also use exit interviews to kind of monitor. You're never going to get more honesty than you do at an exit interview. So we use that to kind of gauge where employees are finding our benefit plans.
Caroline?
So, we did a survey. So our plan year starts in March. We're a little bit different than a lot of companies. We don't go off a calendar year. So the end of 2021, when we started looking at our benefits for the next plan year, we did an employee survey. And we asked everybody kind of what they thought of the current plan, what they would change, do they understand what's available? And then we specifically asked about adding medical and dependent care flexible spending accounts, because that was something that I was pushing for. And we got a lot. It was some answers that I could have predicted and some that surprised me. It changed the way we kind of communicated our benefits for open enrollment and for new hires, as far as, you know, people were maybe not quite understanding what was available. We do offer, we fund half of the deductible for all levels of coverage for through an HRA, which a lot of people didn't understand that, yes, we have this $5,000 deductible, but the company is paying the first $2,500 of it. The majority of my employees aren't going to get to that $2,500 in a plan year. Knock on wood, and hoping, you know, barring any unexpected medical crises. So making sure they understood that. What surprised me was we got a lot of positive feedback about the flexible spending accounts. And then when we added it, we only had about 10% of our workforce actually opt to enroll in it. And when I did a follow-up survey a few months ago, kind of mid-year through the plan year, a lot of the I said, are you enrolled in the FSA? And if why or why not? And a lot of the feedback I got from people was, well, I didn't really quite understand how it worked, and I was worried about putting money into it and losing it at the end of the calendar year, which is always a possibility with that type of plan. So now I know when we do look at our open enrollment benefits for next year, to make sure maybe we put a little more emphasis on the communication about how the FSA plans work.
It's a great recommendation. Do any of your organizations provide new employees with the value of their total benefits package, so that if they happen to be considering opportunities outside your organization, you're showing them what that value is? I'm just curious if employers are moving in that direction at all. Kathy, it looks like you're coming off mute.
We don't use it as much for attracting employees, but we do use that as a retention. I have used that as a retention during review time, performance appraisal time, because it really puts into perspective for employees what their total compensation package is. It's not just about the salary. It's about all of those wonderful benefits offerings that the company is paying for. I'm actually very happy to say that I get great feedback from our employees about the benefits package we offer, and how, you know, having shopped around other employers and just having had experience with other employers, they're very pleased with the package that we offer. And we do have great utilization of the health related benefits that we offer. But yeah, the total compensation is a real eye opener for people and very valuable as a retention tool, I think. But I like the idea of using it also as a tool for attracting.
Yep, it would be interesting, right? Everything's been changing in the last couple of years. Maybe it could be another tool. All right, let's open it up to another question. I think we've answered a lot of this, but so I'm looking for any new ideas that you might have. As employers evaluate their benefit offering, what do you see as the must-haves? So we've talked about the 3 that everybody has. We've talked a little bit about mental health opportunities, or not opportunities, but services being offered, and telehealth. Is there anything else in your opinions, or Lori and Nick, trends that you've seen in terms of those must-haves?
Yeah, I'll jump in because it's kind of what we do in my segment within UnitedHealthcare in a couple of different things. We call it anything within our financial protection department, right? In the products and services that we offer. So disability leave management, right? So when you think about disability, it's basically paycheck insurance. You think about one of the things that most people can't live without. We can't live without a paycheck week to week or month to month. So making sure that you have an adequate disability plan, short-term, long-term disability, leave management, being able to manage things like FMLA leaves, state mandated leaves, different required mandatory paid leaves in certain states now. And things like critical illness, like I talked about before, being offered to offer a suite of voluntary type products, things like critical illness, things like a hospital indemnity plan, things like a accident plan that offer additional benefits above and beyond what your medical plan would be. Any type of voluntary benefit like that allows the employees to get additional benefits while at the same time not increasing overall costs to the employer is definitely what we're seeing in the marketplace, especially with our prospective prospects and clients.
Great, thank you, Nick. Okay, I'm gonna move on to another, oh, Lori, go ahead.
Yeah, I'm just kind of along the lines of financial protection. I mean, a lot of us have pets and a lot of us adopted pets during COVID. We're definitely seeing an increase in customers looking to offer pet insurance. Having 2 dogs that have had 3 ACL surgeries in the last 3 years, like having that financial protection for our beloved pets. I think there's definitely been an increase in the last 2 years in companies looking at pet insurance. Completely out of the realm of health benefits, but definitely an increase in that area.
I am not surprised, and that's good advice. Thank you, Lori. Another group question: how can we ensure that health and benefit plans are inclusive of all abilities and needs? I love this question. I'd love to hear from Kathy, Caroline, and Patty. How can we make sure our benefits are inclusive to anyone of any level of ability and needs? Nick, Lori, same to you guys. I mean, what are you seeing? And this is a conversation, when we look at DEI initiatives amongst businesses across Maryland and the conversations we're having, it's really important that people of all ability levels have access. And so I'd like to hear from either the private businesses or UnitedHealthcare about what you're doing to ensure that.
So I do see that the customers we work with are beginning to kind of regularly review their benefit design to identify if there are gaps specific to diversity, equity, and inclusion, as well as like social determinants of health. And, there are a lot of community benchmarks out there, taking a deep look at your plan and seeing if you're meeting those sort of industry or community standards, I think is one thing. Collecting, feedback again from employees on what they need to feel supported by their employer is another area. And just making sure that we talked a lot about communications and the need for regular communications, but making sure that they're also culturally competent, I think is a good way to ensure that the benefits that are being offered are viewed as inclusive of all.
So I think I know what you mean by culturally competent. Can you unpack that a little bit more?
Yeah, I would just say, look at your population, the imagery that you're using, is it relevant to your population? Ethnicity, race, I think all of those, should be looked at to make sure that the way and the communication tools that you're using are going to resonate with your employees.
I couldn't agree more. Thank you. We have about 5 minutes left. We always get that one question at the very end that someone has been eager to ask and doesn't actually put it into the chat until about 30 seconds before we end. So I'm going to encourage one last time. If you have a question for this group, let's add it into the chat. I'm going to ask one final question for the group. And this is really taking the perspective as an employee. So let's put on we're all employees too, to some degree. So let's put on our employee hat. What are some pragmatic ways that the employee can communicate their health plan needs to their boss? And this could be challenging because people might feel like they don't have an environment, which they can. But in your eyes, how can an employee go to their employer and say, these are my needs? What would you recommend? And should there be a vehicle for them to do so anonymously?
Yeah, this is Nick. I can jump in. There should be a vehicle. I mean, I think absolutely. I think it starts with the relationship that a manager has with their employee at the ground level, right? I would hope that all of the people that report to me we have a rapport and they feel comfortable enough with me to know that they can always come to me. And if they feel that there's something that's missing, bring it to me. And then the same thing. And as it goes up the chain of command, I feel comfortable with my manager to bring that up. In addition to that, I can't stress the importance of employee surveys. We do multiple internally at UnitedHealthcare every year. And not only doing the survey, but then taking the feedback that's learned from that survey and taking action on it. And that's I can tell you as an employee of UnitedHealthcare how impressed I am whenever we do one of these surveys, that when we do the surveys, the results are reported back en masse as a group, then they're reported back at a local level, and then they're reported back to a team level. And again, all done anonymously. And you can see the action items that are done both from a senior leadership level down to a local leadership level, down to the employee level. And it's incredibly impressive. It makes you feel like you have a say in the company and a say in the culture. And we've seen change, and we've seen change in some of the different benefits that we offer, some of the options that we have within our own medical plan at UnitedHealthcare as an employee, all based off of that feedback that's gone on over time. So again, cannot stress the importance of employee surveys.
Well, and to that point, Nick, I think it builds trust when you hear from your employees and then you make a change because of their direct feedback that's beneficial. That just builds greater trust and respect, I think, from the employees. Lori, do you want to have the last say here?
Yeah, I would just say, think about forming an employee engagement committee. Like, what a better way than non-management employees to sort of gather feedback from the field. I think that is offering that. I think that most companies, there will be employees that jump up and volunteer to participate and share what they are seeing as well as their coworkers.
Excellent. And I think we have one final question. It always happens. So thank you to the person who asked it. And then this will be our last one, and we're going to wrap up. What can you do to help an employee who is at the end of their career with the company that they want to stay in? So I'm not sure that I quite understand it. How can you just help them towards the end of their career, I think, is the general question here. And maybe this is more for Kathy, Caroline, and Patty. And you've got someone who's nearing the end of their time and maybe isn't as comfortable or familiar with some of these offerings, but they could really benefit from it. I think that might be where this question is going.
I think that just, echoes what Nick said, is that you need to have options, and to the DEI, you need to know where your employees are so that you can see them and help them through the different stages in not only their lives and their careers. But that's something that, specifically at our company, we would focus on in one of our monthly meetings. I would, either offer to meet with the employee individually and help them navigate. It's a big change, navigate through it, or offer any services I can, or if I find that more employees are interested, maybe there's maybe that's opening up a door for a communication vehicle.
Absolutely.
So looking at
Thank you. Thank you, Patty. All right. I'm just going to say a quick thank you to Lori, Nick, Patty, Caroline, and Kathy. Sadly, we are out of time for today. I love the audience participation, but we really do want to thank our panelists for this fantastic discussion. We have heard some great insight that I know our members of the audience and the members of the chamber can and will use. A recording of today's webinar will be posted on our YouTube channel, as they always are, along with the other 3 that we've done in the past year with UnitedHealthcare. And all of our participants who were registered will also be emailed the link today. So thank you again to UnitedHealthcare, our sponsor of this webinar series, for partnering with the Maryland Chamber over the last year to bring this important content to light. We've had some really valuable conversations today, included all about whole employee health. So we appreciate you, our audience, for being with us this morning. And from me and my team, we hope you guys have a great rest of your day. Thank you so much.